Hi everybody. If you've been here before, thanks for tuning in and welcome back. If you haven't, my name is Amber. I'm otherwise known as the Wobbly Wife. Welcome to my channel. In my first video, I discussed the reason for making the channel and also gave you guys a general list of many of my multiple diagnoses. In this video, I want to discuss how my husband, John, and I went about obtaining my original hypermobile EDS diagnosis and how we got it so quickly, and also how we were led to craniocervical instability, or CCI, and my personal journey on that diagnostic path as well. So this all basically started back in August of 2024. We were getting ready for our wedding. We were getting our house ready and everything. We'd been married for a while, but we hadn't had a wedding at that point, and we wanted to take our vows. So all of my symptoms really started getting really crazy at that point. I'd always had weird stuff growing up as a child and in my early 20s and everything, but this was on another level. I was having increasing pain in my hands, my wrists, nerve pains, joint pains, all kinds of different pains, shoulder pains, hip, my back was killing me. I was just miserable. I was starting to really lose functionality and things were just coming to a head. So, we went around and did the mainstream medicine system and started with a certain primary care doctor, and I'm no longer with him, but we started with that. And I explained my symptoms. He sent me to several different specialists, neurosurgeon, spine surgeon, cardiologist, etc., for all my different symptoms. Another one of my symptoms was like shortness of breath, felt like I was having heart palpitation, things like that. And so we did all the mainstream stuff, and I had x-rays, MRIs, the regular MRIs, regular x-rays. I had EMG, nerve conduction studies, echo, rib x-rays, spine imaging, and all they came back with was minor lumbar scoliosis, some bone spurs, a little bit of degeneration, and a little bit of my cervical spine, C6, C7, and loss of my cervical curve. Oh, and they diagnosed me with like minor carpal tunnel syndrome in my wrists, which I knew none of that was really explaining any of my symptoms. So it was about this time when it was after our wedding, and we just went about the wedding, and I was doing okay, I guess. But in November, I think it was, I had this major, out of nowhere, giant thunking in my thoracic rib region. It was like a big thunk, and it felt like something had moved. And then it was about a week, I would think, that I was on the couch. I couldn't move, I couldn't breathe, I was in excruciating pain, I couldn't eat anything, I was completely bloated. It was just awful, it was miserable. And my husband, John, he's an avid researcher, and this is what started the ball rolling. So he started looking into all kinds of stuff and came across slipping rib syndrome. And so when he came across that, I looked into it and I read about it as well, and we were both like, wow, this sounds exactly like what I'm dealing with. And so the slipping rib syndrome was noted to be one of the co-occurring or comorbid conditions for a lot of people that had hypermobile EDS, or hypermobile ehlers-danlos syndrome. So when we discovered that, it led us down the EDS rabbit hole, up until which point we had not heard of either of these conditions. So we started down the EDS rabbit hole, and at that point we realized that basically my whole life and all these weird things that I had dealt with my entire life, my childhood, everything started to make sense. And I want to go into another video more in depth of all of my childhood symptoms, because I think it will help maybe a lot of parents who are questioning, should I get my child tested? Should I get my child looked at for this? if any of these weird things, sometimes they seem minor, but putting all of them together really put the puzzle together for me. And the big picture, it was just mind-blowing how everything made sense. So at this point, I had switched primary care doctors. And what John and I decided to do was to compile a list after we had done all the EDS research and were convinced that I had EDS along with the slipping rib condition. At that point, I think it had thunked itself back into place, and I was no longer in misery, excruciating pain, but it was still kind of loosey-goosey over there. And I was dealing with all these other conditions and symptoms as well, with my hands and nerve pains and all kinds of weird stuff. So I went to my primary care doctor with a huge list of all of my symptoms from childhood, all of my current symptoms. And the other thing we did was we went ahead and printed out the international Baton score and diagnostic criteria for hypermobile EDS. And I'm going to go ahead and insert a little picture of that. And I'm also going to attach the PDF file into the comments in the description so that you guys can take that with you to the doctor and, help empower you if you feel like you match the criteria. So my doctor, I don't think, was very familiar with EDS, but when I went in, I was prepared. I had a list of all my symptoms. I was confident. I was convinced. I also had that paperwork already filled out for her, for me and my husband basically evaluating me at home, which anybody can really do that. It's a clinical evaluation. Obviously, you need to get it confirmed, but we went in there very confident about everything. And sure enough, she wasn't familiar, but I spoke to the nurse about my concerns. I gave her the packet of all my information. She took it back to the doctor, and the doctor spent like 15 to 20 minutes looking it over before she came in. And we did everything together, the Baton test, and I was a 9 out of 9, just like I was at home, and all the other criteria I met. So I was diagnosed there. And then later, we confirmed it with the ortho spine doc. He also confirmed the diagnosis and redid all the criteria with me in his office setting. So I was confirmed twice with hEDS. So at this point, I was just so relieved to have an explanation for what was going on. And I was grateful for my primary care for being so open-minded and supportive. But I think what made a big difference in our situation was that I went in there confident, prepared with a lot of notes, and I was just sure that that's what I had. So I think that really does make a big difference to advocate for yourself and go in there confidently. So at this point, it's like late 2024, and I'm still struggling with all my symptoms. But my primary was trying to work with me and get me into specialists to, try to work with my symptoms and see if we could get to the bottom of this or that or the other. But my husband was still, busy researching at the time, and I was just kind of trying to push through, but at least I had, a diagnosis and answer. And then what happened next was in January of 2025, I was still somewhat functional, and I was driving home from a work meeting, and I checked my left blind spot. It was a merge onto a pretty busy four-lane type of road, and I checked my blind spot, and I felt a big thunk on the left side of my head. And when I felt that, my vision went completely blurry for a second. I couldn't see really anything at all. And it was almost like a mini blackout. It was really quick. But then when I got my vision back, it was like stars and like visual snow, and it was really scary. And after that point, I made it home. I was almost home at that point, but I made it home. And after that point, I decided that I was too nervous to drive because I didn't know what was going on. And when I got home, I realized that I could barely hold my head up. And I was starting to have all kinds of weird, symptoms, severe pain at the base of my skull. I was having like all this coat hanger pain between my shoulder blades, which I'd always kind of had that, but it was becoming to the point where it was really, really, really unbearable. Like it was burning so much. It was just burning, and it was so tense. I've always had migraines, but they became so frequent and so severe that I'd be in bed for 3 days straight sometimes. It was ridiculous. My ears were full. They would ring. It was just awful. I had tinnitus really bad, especially on the right side. Turning my head was basically impossible. It hurt and it felt scary, as if it was loose. I had a bobblehead sensation all the time. Dizziness when, if I turned a little too quickly, even if I turned my whole body, it was like everything was off. My proprioception was completely off. I had no idea where I was in space. My head felt super heavy. I mean, it felt like I was carrying around like a 20-pound bowling ball or something. It was ridiculous. And bending forward was the most painful thing. I would get all this pressure and blood that would feel like it would rush to my eyes, pain in the back. It'd feel like my head was just going to fall forward and fall off my neck. The scariest thing to me was, at one point, I would be barely turning, and there would be this weird thunking sensation inside my throat. And it was almost as if there was a vertebrae or something that was misaligned, and it kept thunking into the back of my throat. And almost like when you pass somebody on the street and you like bump shoulders with them, that's kind of the sensation it was on the inside of my throat. It was so creepy. And I really thought like it was going to cut into my esophagus or something. I didn't know what was happening. Around this time, I also started having a lot of trouble swallowing food, water. I would choke a lot. Have to swallow things really small, take really tiny bites, take my time, really think while I was chewing. And then my voice started to go out, and it still does from time to time. It's gotten a lot better since I started treatment, which I will talk about next, but sometimes my voice does go out, and sometimes I still do get brain fog. That's the other thing that got really bad, is that I'll get brain fog and I'll completely lose track of either what I was saying or what I was doing. And I mean, it's ridiculous. But it would get to a point where I couldn't even talk. I would be talking to somebody, relaying a message about work or whatever, and then all of a sudden my voice would just basically disappear, like I had laryngitis. And it would come back later in the day, but it was so strange. And then I had a lot of trouble sleeping. I was sleeping, at this point, I was wearing a hard collar 24/7. I'd gone through the mainstream medical, route, and gone to see a neurosurgeon and a spine surgeon at this point. One of them basically, told me it's all in my head, your x-rays are fine, your MRI is fine, you have nothing wrong. And I asked for a neck brace, and he kind of laughed. I think he thought I was like, exaggerating or something like that. Anyways, it took the insurance forever. He finally said he would get me a neck brace, but it took insurance forever. So John and I just bought one on Amazon. The one we got was the Aspen Vista, and I really liked it. I'm tiny, like short. I'm really short. I'm 5'4". I weigh about like 125, 130 for reference for anybody needing a neck brace. And a lot of the neck braces out there, they looked humongous. They looked really bulky, and I didn't want it to like swallow my entire head. So the Aspen Vista wasn't too bad as far as that's concerned. I still have it, and every now and then if I'm in a lot of pain for some weird reason, I couldn't lie down for that day, I may still put it on, but since I started treatment, I really don't need it. But at that time, I was wearing it 24/7, even when I was sleeping. So I wasn't comfortable. I couldn't sleep on my side. I had to sleep on my back. It was, really bad. So the mainstream doctors weren't making any progress. So John, again, with his researching, started looking into neck problems, all of the symptoms I was having, typing stuff in, looking on YouTube, and he came across some YouTube videos from a clinic called Caring Medical and a doctor called Dr. Ross Hauser. And he was going over CCI, or craniocervical instability, which we at that point hadn't really ever heard of, but we realized that it was related to hypermobile EDS and that it was one of the comorbid conditions that hEDS patients are sometimes susceptible to. And after we watched some of the patient testimonial videos on his YouTube channel, everything clicked. And we knew that that's exactly what had to be the case for me. So at this point, we knew what I had. We just had to basically get diagnosed. We had to follow the channels. So I looked into diagnostics here in my state. I'm in Texas. And I also looked into different treatment options for my condition. We hadn't proven with imaging or anything that I had this, but I was pretty convinced. As was John. And we were right about the EDS, and so we were pretty sure we were right about this as well. So we looked into different treatment options and different doctors here near us to treat me and diagnose me. And the options, nearby were mostly just the surgical fusion. So basically, getting your skull screwed to your cervical spine all the way down, however far they need to go. And, with metal plates. My mother's had a similar surgery, I think from C4 to C6. I'm not sure, how happy she was with the results, but I know she still has a lot of issues with her, head pressure and migraines, things like that. So I'm not sure that she's fully cured after her surgery, or I know she's not. So anyways, there's also a procedure called the PICL, or the PICL. And basically what they do with that is they take out your plasma, they spin it up, PRP, or they use your bone marrow, and then they inject it through your throat into your alar or transverse ligaments. And that didn't really sound appealing to me, neither did the fusion surgery. So because we knew about Dr. Hauser and Caring Medical and his upper cervical prolotherapy program, we decided to look into that, as that seemed like the least invasive and the least permanent option. And so we applied to that program. It's basically you send in your symptoms, and they don't really care too much about your other imaging. They do all their own imaging. But you just send in all your symptoms, and then they decide if they want to take you on into a phone intake. And so then they do a phone appointment with you. So I had that phone appointment. I sent in all my information. I sent in like a letter saying, Dr. Hauser, please take me on. I'm desperate. And explain my situation and all my symptoms, and also kind of my history as a child and a young adult, etc. And my family history with the hEDS, and that I think that my mother and grandmother probably also are on that hypermobility spectrum as well. And then they did a phone appointment with me. So I was accepted to the phone appointment. They called, they did all that. And then in about, I guess it was from January to March, I was pretty much 24/7 in a cervical collar on the couch, having trouble sleeping, useless. And then in about April, it was the beginning of April of 2025, when we got my first appointment, and I was able to get my imaging done, meet Dr. Hauser, and get my diagnosis. So just real briefly, and I'm going to make another video more in depth of craniocervical instability, in particular CCI, and my specific diagnostic process. I'm going to share some of my imaging and all of that, but I didn't want this video to get too long. So in the next video, I will go more into depth with what happened at my first appointment and how I was specifically diagnosed and what imaging they do at Caring Medical. But I had a digital motion x-ray, I had a cone beam CT, and they did a bunch of neck vitals testing with ultrasound, which was really cool. So with that, you get to see how your vagus nerves are working, how your jugular veins are draining, among many other things. They also test your eye pressure. It's really cool. So I got to, see all that, and we found out a lot of information, which I'll share more about in the next video. But I definitely was diagnosed with, I would say, moderate to severe. I don't know, severe definitely at C1, C2, and I would say C3 to C7 was moderate instability. But C1, C2 was 6.5 millimeters slippage on my right side, and I believe, don't quote me on this, I believe it was 4.5 millimeters on my left side, but that may not be right. But I know it was 6.5 on my right for sure, because that was qualified as severe. So I got diagnosed, and then pretty much immediately the next day we started prolotherapy treatments on me. So I did upper cervical prolotherapy, and that was pretty scary at first. I was really nervous, but I'd watched some videos. I kind of knew what to expect. I just didn't know how severe the pain would be because of some of the medications that I'm on. And I also don't like hydrocodones or opiate type medications anyways. I opted out of the pain medicine that's offered. They also offer like an anxiety medicine. I think it's Xanax or something like that if you want it. But all I use, and you can get sedated if you want. You can get put under general anesthesia, but you have to book that in advance. It's pretty expensive. So I just decided to just be kind of tough and hope for the best. So it wasn't nearly as bad as I thought. So I just did the nitrous gas, and that was plenty for me, and just took some regular Tylenol, and then laid on my stomach. And once the gas kicked in, they did about, I think they said it was about 80 shots from your skull, and they start at your C7, and then, or they did on me. They started at my C7, and then they worked their way up to my skull. And it's not 80 full injections. It's probably 20 full injections, and within the 20, there's 4 each. And it's a wobbly needle, and it's really skinny, and they just kind of move around inside. And they put local on your skin, so you don't really feel the prick. You just feel the inside pain. And it's not terrible. It's bearable. I do have a pretty high pain tolerance, but they call that, productive pain. So I felt pretty good about what was happening. I was excited to finally be diagnosed and to be treated by Dr. Hauser, who'd been working on the upper cervical spine for the last 30 years. So I felt confident in our decision to go with him. And yeah, so since then, that was in April of 2025. Since then, I've had a total of 6 neck treatments. And as you can see, I can hold my head up pretty much all day. I do get tired. I do take a lot of breaks. I do need to rest. I can start to kind of feel pressure towards, the end of my run of needing to hold my head up. And then I know, it's time to go lie down. But I have come a long, long way from where I was in the beginning of treatment. And I'll go over more of my symptoms specifically in the next video, and how far I've come since then. And if you guys, have any questions about that specifically, I hope that I'll answer them on the next video, but also feel free to send them in. So I have definitely had a lot of marked improvement in my symptoms since starting treatment, and I'm glad that I have not decided to do any type of invasive surgery or the pickle procedure. That's my personal choice. Definitely not giving any medical advice here. I just wanted people to understand kind of what prolotherapy is if they hadn't heard of it before. And I will also have a more in-depth video, explaining the prolotherapy procedure and step by step exactly what happened. So basically this is kind of my second introductory video, and I'll have more detailed imaging and everything in the next set of videos. I'm going to try to post once a week. I don't want to be unrealistic with myself. It's probably going to be more like every 10 days to 14 days, just because, you know, with chronic health, a lot happens and sometimes you don't feel great, and we have a pretty busy life. So anyways, just the big takeaways from all of this that I wanted you guys to know is that the signs were there for EDS my entire life. It wasn't, you know, really a fully recognized condition, I don't think, until like 1998. I may be wrong on that. I think it was pretty sure it was 1998. And then the new criteria came out in 2017. So, you know, as a child, you know, we didn't know anything about this. I was born in the late 80s. But all of those symptoms that seemed unrelated at the time now make total sense, that they're all, you know, leading to hEDS. And then my CCI symptoms now make total sense, that, you know, it's craniocervical instability as well, and not, you know, all of the many other normal things that they could maybe diagnose you with. And understanding, you know, the root cause has, you know, helped me make sense of everything and all of my weird childhood stuff. And just, if your story sounds similar, just trust your instincts, get your notes together, get your international hypermobile ehlers-danlos criteria together, and go into your primary care doctor with confidence. Learn to advocate for yourself, and I'm here to help. That's why I'm doing this. I'm going to provide that link, like I said, to that 2017 criteria if anybody needs to print that out and fill it out and take it into their doctor, so that they can feel like their doctor may take them more seriously. Then that's why I'm posting that. The next video will focus more on CCI in depth with imaging and all of the details about all of my diagnostic journey and how all of those tests went, and all the details about that, because they were all really cool and in depth. And the cone beam CT was cool, the neck vitals were very in depth, and the digital motion x-ray, I think, is the gold standard, or should be the gold standard, especially for the upper cervical C1, C2 instability. So I will try to post a little clip of my DMX, my original one, so you guys can see how that process is, because it's pretty awesome. And I think if you have access to it, it's definitely the best way to get diagnosed. If you don't, just a quick tip, you can do an open mouth x-ray. Ask your doctor to order an open mouth series x-ray. So you're going to open your mouth and tilt your chin up, and then they're going to have you tilt your head down to each shoulder, the ear to shoulder on both sides. And that's when your mouth is open, they can see the C1, C2, and they can see how far the C1 slips down off of the C2, or if it stays stable on each other. So just a quick tip for you guys who are needing diagnostics and may, you know, be in a rural area or not near a DMX. I mean, I'm in Texas and I couldn't find a DMX easily near me. So, and I'm not in rural Texas, I'm in DFW. So anyways, if you guys have any questions, just let me know, comment, like, I appreciate it. And I will be back in the next 10 to 14 days, something like that, with another video on CCI and my specific diagnostic journey, along with clips of my DMX. See you guys later. Thanks.